Well, hello there. So today I'm going to be going live because I had a test result come back that kind of blew me away. Okay, I'm going to turn on some lights so that way you guys can actually see me. Hello, everyone. So we had a test that came my way from one of my patients who came out from Ohio. Now, again, I'm in Pittsburgh, so when people come in from different states, a lot of people were like, "Why the heck why is someone's family coming all the way out to come and see you?" Well, quite honestly, it's because we do something very unique and different that most other chiropractors don't do. Okay, not only do we do X-rays and structural correction and postural correction, corrective care chiropractic, but we also do the wellness way approach. Hey Heather, thank you for tuning in. So we also do the wellness way approaches, which is our motto. If you can see up in the corner right here, it says "We don't guess, we test." Why is that important? Well, really, because what happened is I'm getting very, very well known out in Ohio for getting people well. Okay, it's not that I'm necessarily getting people well, but what I'm doing is tapping into your God-given potential for your healing ability. Now, whenever we see a cancer or we see a disease or we see something like that that's happening, it's an adaptation of the body. We need to figure out what happened in the internal environment that made your brain and your body choose that the best way to keep you alive is to shift into this disease process. Whether it's, again, cancer, diabetes, heart disease, you name it, we have to figure out what is going on and what that underlying cause is. And until we do that, we will never, ever, ever get to the cause of any disease, no matter how many races we race against the cure or whatever the heck people are telling people nowadays. So I'm going to go into something here today. So my caption here is, so you get diagnosed with cancer. Okay, you have cancer. What are you going to do? This is a question that comes up quite often. People ask me, if I'm talking to somebody about cancer, I'm not helping anybody. I'm not curing cancer. I'm not doing anything in that realm. But what I am doing is making a sick person healthy by figuring out what made them sick to begin with. So when we have disease process, we always have to have a plan in mind. Okay, just like my wife going through being pregnant, going through birth, we had a plan. We had a step-by-step plan. This is what we were going to do. This is what's going to happen if anything bad would happen. We always make sure we have a plan because we have a running joke that if you don't make a plan for it, something bad could happen. So when you think about this, I mean, 1 in 3, 1 in 2 people are getting diagnosed with cancer every single day, and the overall success rate for cancer treatment in a normal medical model is only 2%. 2% over 5 years, and I keep harping on that statistic because it's so true. For the past 30 years, we have been raising billions of dollars. We're not getting anywhere with it. Why? Because we're not treating the person as an individual, we're treating the person as a symptom. So when you go into any doctor's office, if you come in with cancer, if you come in with prostate cancer, breast cancer, whatever it is, they have a standard protocol for that particular symptom, okay? Diabetes, we're going to give you metformin. Cancer, we're going to give you chemotherapy, maybe radiation. There is a cookie cutter approach that they use for everyone. But realistically, if you look at anyone who has cancer, no two people are alike. You can have somebody who has a flawless diet, a vegetarian diet. We'll just go vegetarian. So they have a vegetarian diet, they exercise all the time, they make sure they sleep really well, they're always juicing, they're always making smoothies, they look like a pinnacle of health, and all of a sudden they get diagnosed with cancer. And you're like, how the hell did that happen? And then you have somebody on the other side of things where they eat McDonald's all day, every day, and they're eating crap, they're eating pop, they're drinking pop, whatever you do with that stuff, and they get cancer. And you're like, well, that's kind of no wonder that they did, but, there's different ways that we can come to this symptom. There's different ways that we can come to this diagnosis. We have to figure out what caused the individual to be sick to begin with. And everyone's cause is going to be different. Now, there are some obvious things. If you have diabetes, you have an excess blood sugar, you have excess glucose in your blood, we need to work on figuring out why your pancreas is not getting that under control with insulin. Okay, you can have insulin resistance, you can have other things, you can have a horrible diet that's causing your body to ultimately be spiking up your blood sugar. We need to bring that down. Right? 9 times out of 10, diet. So a lot of folks don't understand the importance of having a healthy diet. And it's not this standard American diet, this cookie cutter diet, but it's another video that I'm going to kind of leave as a cliffhanger for you guys, because what it's going to go over is how to eat depending on how your autonomic nervous system is functioning. It's pretty neat stuff. It's been around since like the 1900s, but it got kind of pushed aside, and then there's a guy who brought it to the surface again, and he actually got taken out. So hopefully I don't, but if they come after me, it's going to be one heck of a fight because I think I can take most people. That being said, let's go into what the heck I'm actually talking about today. So you have your action plan, okay? So say You get that diagnosis and you're like, you know what? I've already known that this was coming. I made some poor life decisions and all of a sudden I get the diagnosis. So what are you going to do? So you're either going to go the wellness model of things or you're going to go standard medical, okay? Now, if you do the wellness side of things, you're going to go through, you're going to get a food allergy test, you're going to get a stool test, you're going to figure out what your cancer markers are, you're going to figure out where your tumor markers are, your highs, your lows, what's going on internally that made you express your cancer, whether it's immune system cancer or hormone-related cancer, or why your body is the way that it is, okay? But say you go to the normal allopathic. Good luck. Right? I say this with love and compassion because there's a lot of folks that get suckered into doing this because the medical model will scare the sheets out of you to force you into their model. And they will threaten you and say that they're either going to drop you as a patient, you're going to die, your cancer is going to come back, this is going to get horrible, and you're basically going to die. Good luck. You might as well pack your bags and move away from your family because you're just going to be a burden to your family. We actually have a patient that's going to be coming in tomorrow. This really upset me. She's a 19-year-old girl with non-Hodgkin's lymphoma. She's doing fantastic. Fantastic. Her tumor markers, everything, her blood work looked amazing. And her doctor had no freaking clue what the heck she was doing. She wasn't taking her medication that he was trying to prescribe and wanted to do a PET scan, okay? Which is basically throwing in radioactive sugar, okay? Cancer feeds off sugar. Radioactive, toxic. So you're putting radioactive sugar into the body and it's going to shunt into any cancer cells that are there. It's basically throwing Miracle-Gro into the body and allowing the cancer to grow out of control. So I talked to the patient, I talked to their parents, and I was like, listen, like, maybe this isn't the best decision for you, okay? I'm not here to tell you, you know, medicine's wrong, but realistically, if we have things under control, you're getting better, you're feeling better, your markers are getting better, then what are you going to do? You're going to sit there and you're going to throw Miracle-Gro into your cancer just for a test to see if there's anything going on? I'm like, go get a thermography scan. Let me know what that says. So this person's oncologist text messaged her. An oncologist, text, okay, saying basically, you need to get your butt in here. We need to run a PET scan on you or else. She's like, why? Did my blood work say anything wrong? And he was like, no, nothing new popped up, but we need to get you in so that way we can basically start treating you. And she's like, well, I'm not doing that. I'm not interested in doing that. I would rather do what I'm doing now because it's working. So the guy got really, really, really ticked off via text message and basically threatened to drop the patient, threatened and said that her cancer is going to go back, and if they're not aggressive about it, it's going to come back, she's going to die. So then I get a phone call from the parents and basically like, what the heck is going on? Well, this guy doesn't know what the heck he's doing. Okay, he truly, truly doesn't. He's upset because he cannot medicate, he cannot put this person through treatment because there's no clinical evidence as to why he would need to do this protocol. And they're trying to get them to pay $12,000 for some certain shots and also get a PET scan. I think was $3,000 for that, okay, because they pay out of pocket. So thermography scans, a couple $100 to get that done, maybe. And we already have all the testing, we have the protocol and everything set aside for her. She's doing amazing, fantastic. We'll be seeing her tomorrow, so I'll be giving you guys updates on that. Now, the other thing that can happen is when you do get guilted into, however you want to pronounce that, I don't care. If you do get guilted into that, what's going to happen? So you're going to go and you're going to get your chemotherapy. Okay, if you get chemotherapy, what's that going to do to your body? If you get chemotherapy, chemo was actually created from Agent Orange. Basically, it was a weapon of warfare back in the day that people would use to ultimately kill off people. Okay, it was very, very, very obvious for that. Tuning into myself so I can watch myself, so I can look at myself. I'm just kidding. Just see who's on here. If you want to, I see 5 people are on here. Just go ahead and put your name, who you are, where you're from, etc. Yeah. So it originally came from Agent Orange, and basically was they found out that it killed rapidly dividing cells very, very, very quickly. Cancer, rapidly dividing cells. So they're like, well, maybe if we use that to kill cancer, it will work. Well, the 2 areas where chemotherapy or Agent Orange works the best is most notably is going to be hair. That's why a lot of people who go through chemotherapy lose their hair almost instantaneously. And then what happens to the belly? The belly starts to get destroyed because your hair follicles and your GI tract has some of the fastest replicating cells in your body. So it's going to target the cancer cells, your hair, and your GI. Now, a lot of your immune system is hosted in your digestive tract. So if we're pounding our GI, we're pounding our hair follicles. Hair, it's not a big deal, but when we're talking about our GI, we're destroying our immune system down there. And that's what a lot of people don't understand is when you're choosing these treatments and you're choosing these therapies, there are horrible, horrible, horrible side effects associated with them. Now, I always say this joke too, is that chemotherapy is noted as a biohazard. So if somebody goes to administer chemotherapy in your port and they spill it on the ground, they have to clear the room out, get everybody out because it's toxic. We need to get the hell out of there. But the only place that it's okay for you to have it in is directly in your bloodstream. How does that even make any logical sense? It doesn't. So when we talk about the immune system, we got to talk about cancer. We got to talk about chemotherapy and what it does. So I pulled up a couple articles for us, so that way we can take over here. And I saw Amanda said hi or gave a thumbs up. That's cool too. I like that. I think if I did that, there we go. And Heather, I'll like you too there. Heather's awesome. You're always on all of our videos here. You probably know when I'm going live before I even know I'm going live. All right, so going over a couple in the background, so don't pay attention to this one yet. It gets good, but the impact of chemotherapy on GI function and enteric nervous system, okay? So if I can, see if I can blow this up and make this a little bit bigger for us. Maybe one second. Oh, smokes. Okay, it's a little too big there. Hold on, bear with me. There we go. All right, and survey says, boom. Okay, cool. So highlights of this, okay? Because I clicked on a full article, but believe it or not, it didn't. I don't know why it didn't work. Pain in the butt, but anyway. So highlights. So chemotherapy before and after surgery is the main treatment for colorectal cancer. So this one in particular is going after your colon cancers. Pretty common type of cancer that's out there, and highest prevalency and mortality rate worldwide. So most people die quite often from your colon cancer. So we often think about pancreatic cancer, things like that, people being really bad off. But really, if we don't have a healthy gut, we're going to be in a world of hurt anyway. So anyways, so most common treatment for colorectal cancer is chemotherapy. Now, what did we just say about chemotherapy? We said that chemotherapy is going to go after the fast replicating cells, which is going to be the digestive tract. So if we're throwing chemo into the GI, directly into the GI, we're going to be killing everything off, okay? It's going to be burning the good stuff, the bad stuff, and leaving you in a very, very, very toxic state. And sometimes we even get scarred over from it, and you will not be able to replicate normal healthy cells again to replenish the ones that you just killed off. So the reason why we have such a low mortality, or such a high mortality rate and a low rate of success is because our forms of treatments, first off, are completely barbaric, but also they're outsourced. They're not as good as we once thought that they were. I'm sure when this came out, the people truly had a good heart and they had a good, they truly wanted to help people, but then it just turned into a big business. And now everyone knows that chemotherapy doesn't freaking work. Radiation doesn't freaking work. It doesn't do anything. And the research says this, more or less, okay? So, again, let me flip the screen here. All right, so there we go. So chemotherapy, there's many side effects associated with that, okay? Including diarrhea, okay? So it basically causes enough inflammation in your gut that it liquefies everything and pushes it out. Constipation. When you have constipation, it's not just the inability to be able to move stuff out of the body, but you're absorbing toxins into the bloodstream. And then if you have bacteria, viruses, parasites, yeast, any of those things, they love themselves some constipation because they get to feed off of that stuff. And it also may persist years after treatment. Why is that? Because you damage the GI tract so much. So basically, there are new approaches that are needed to address this problem because it's basically causing havoc across the board. So that's just one article right there. That was that's the name of the article: Impact of Chemotherapy on GI Function and the Enteric Nervous System. What I'll do here, I'll try to see if this works. I don't even know if it will. That is the link. If it works, cool. That's a link to one of the articles that I just went over there, so you guys can take a look at that one and devour it. Okay. Then we're going to go after this guy right here. Okay. This is another one where I'm going to pull this up real quick, and I'm going to try to zoom this in a little bit more so you can see a little bit more here. But basically, this is the one that's going to be stating, hey, we have massive amount of the immune system in the digestive tract. So if I didn't just screw this up here, I had it previously set here. Oh my Lord, I lost my place. This is fantastic. All right. Anyways, so this article is again going to say that you have about 70 to 80% of your nervous, or 80% of your, or 70 to 80% of your immune system is going to be found in your digestive tract. So if we're causing havoc, and this is the name of this one, allergy in the GI system. Okay, if we're having havoc and we're damaging the crap out of our bodies, and we're basically poisoning ourselves with chemotherapy and radiation, we can no longer, there it is right here, we can no longer be able to, did this work? I'm trying to see on my screen here. This is the one where it's saying, again, considering approximately 70% of the entire immune system is found in this site, so the GI level, okay? So if we're constantly causing constipation, diarrhea, irritable bowel, colitis, these guys, all of them are going to have a much, much, much higher rate of death because we're not going to be able to get rid of the cancer because we have a toxic environment to begin with. So that's just another fun one for us to be able to take a look at. And I'll post this one off in the comment box here as well. Here we are. And then let's get down to the nitty gritty. Let's get down to the reason that I'm actually doing this today. It's not so you can see my beautiful mountainscape back here. This is going to be a patient that we're working with currently, okay? So when we're working with these guys, this is by far the worst test that I've ever had come back from a stool analysis, okay? Now, when I get back stool tests, I absolutely love getting stool tests back. I just had another girl get a stool test, and I love talking about poop because first off, it makes people uncomfortable, and I like to make people uncomfortable. But the other thing is the amount of information that it gives you is vastly important. So when we talk about the immune system down there, we need to make sure we don't have anything causing a weakness in the immune system. We have to make sure we don't have any triggers down there. So food allergies and a stool test are going to be by far the first test that I run across the board with any patients, especially if they have cancer. All right, and I knew that this person was getting chemotherapy. She was getting 2 forms of chemotherapy, and then she was getting a Zometa shot as well that was supposed to help her with her bone density. So I had a feeling that her gut was going to be pretty rough, pretty ragged whenever I saw it, but I didn't know it was going to be this bad, to be completely honest. Now, this patient was diagnosed with multiple myeloma, and again, I'm not going to tell you the patient's name because it's against HIPAA, but I have everything blacked out on this stool sample for you, so you will not be able to tell. Now, if anyone has ever done this stool test before, you're going to figure out very quickly that it's incredibly, or if you haven't done it, you're going to find out very quickly that it's very, very, very in-depth, all right? So before I go over this, Amanda Tran, Marcy, Covey, Leo, this is what I told you about. I don't know what it was. If you're getting me in trouble, Amanda, good, get me in trouble. And hey, Linda, good to see you, and you're welcome for teaching here. She was one of my patients down in Texas. She's a rock star. She knows more than most doctors anyhow because she's self-taught and she's learned so much from some of our other chiropractic friends and colleagues. Okay, so let's go into the fun stuff. So just to make sure. All right, so we just did this test. So this patient was born in the 70s. All right, so not even that old. All right, she came in with multiple myeloma. She had been previously under treatment. Oh my Atlanta. Okay. She had been previously under treatment with some other doctor. Obviously, they weren't getting results with it, so she wanted to see if there was something else that she could do to make her better. So this is a doctor's data, comprehensive stool analysis and parasitology ×2. Mouthful for basically to test the crap out of you, pun intended. Hey, Doris, thanks for tuning in here. I'm glad you're on here because you're usually one of my first peeps to jump on. All right, so when we look over on the left column here, this is what we have. We have very low probiotic count. We want all 4 pluses across the board. We have a 3+, 1+, no growth. NG is no growth. 1+, 2+, 3+. So it sounded like Dr. Seuss saying 1 foot, was it 1 fish, 2 fish, green fish, blue fish, red fish, blue fish, blah, 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 blah. Yeah, so that's basically what that sounded like right there. But long story long, we need all 4 pluses there. If we don't have 4 pluses, we have a massively weakened immune system and a massively damaged intestinal lining, okay? The commensal bacteria are the in-betweeners. It's like your bacteria that are hanging out in purgatory. They're not going to kill you, but they could. It's like a threat. It's like a threatening text message. They might get you. And then we had 2 different types of Siderobacter frundi complex. You have 3+. Again, if we want 4+ over here, we sure as heck don't want anything over here. But if it goes 3+, 4+, that's going to be your stronger bacterial infections. So she had Siderobacter frundi complex. She had Siderobacter frundi complex isolate 2. Okay, so she had 2 levels of bacterial infection. Not good to have. What's that going to do to your GI? It's going to rip it apart. It's also going to make you crave crappy foods. Okay. Now let's move down to over here. We have our yeast culture. Okay, we have our macroscopic here and our microscopic here. They were able to find out that she had a Candida albicans overgrowth here of a 1+. So she has a yeast infection in her gut. So far, guys, we have, if I can switch this back around, even know where my buttons are. So far we have 2 bacterial infections and 1 yeast infection. 2 bacterial infections, both 3+, yeast infection, 1+. The other side note is yeast loves to ride along with cancers. Why? The reason that it likes to ride along with cancers is because yeast will make your body want to eat and absorb sugar. Okay, it's automatically going to make that happen. So one of the most common things people say, hey, I'm on a yeast diet. I'm like, what the heck? What's that consist of? Well, don't eat freaking sugar. Why? Because yeast crave sugar. Same thing if you have cancer. Don't eat sugar. So if you have these two things working together, we have cancer who's making you try to eat sugar. We have yeast that's also trying to make you eat sugar. You're feeding these two beasts. You have one that's weakening the immune system, and the cancer is just going to overgrow on you. It's not a good, delicate balance to have. It's a very dangerous imbalance to have. So when we see people with yeast infections, we want to make sure we kill it off. And it's something that can be a pesky little bugger. We call it the yeast beast, or the yeasty boys is what I nickname it too. So I'm getting a fax here. That's cool. So anyways, when we're talking about yeast, we want to make sure we kill it off and keep it off. So we test it, we find it, and then we kill it, and then we retest it, okay? Because we want to make sure we confirm the kill. I'm aggressive with it. We have to make sure we kill it. I also don't play any games. If you have yeast, don't eat sugar. If you eat sugar and it doesn't die, it's your fault. You're the one who didn't follow the regimen. You're the one who didn't follow the plan. We go more months where you don't eat sugar, and you shouldn't really be eating sugar anyways. So we found out those two were going on, okay? We found out that the 2 bacterial infections, okay, 1 yeast infection, and then we're going to go down to the next page here, okay? Making sure that stayed there. Look at this fun stuff. Look at that. So this, my friends, are your parasitology and microscopy samples, okay? So what does this let you know? This lets you know that not only did they have 2 bacterial infections, 1 yeast infection, but now they have 3 types of parasite infections. 3 types. Parasites suck. There's a lot of places where you'll go and you'll get cancer treatment. And one of the first things that they do is a parasite cleanse. Why? Because a lot of times parasites can induce cancer. But when you have this many, there are different types of ways that you have to kill off these particular strains of parasites to be able to get the best results. So if we go back to this here, let's talk about what this actually means. So we have what's called, let me see if I can zoom in on this a little bit. Maybe not. Let's see. Whoop. There we go. A little bit bigger for us here. Okay. Boom. So we have Blastocystis hominis. Okay. And then we have Chilomastix mesnili. All right. Sounds silly. Then you have cysts and you have trophs. Okay. Cysts are like your babies. Trophs are like your adults, or adults, however you want to say it. And she even had a little bit of yeast in that sample too. She had a whole bunch of crap in her crap, okay? So Blastocystis hominis is going to be fecal-oral transmission, same thing. Chilomastix mesnili is also fecal-oral. So how do people get this stuff? So a lot of times, especially my patients out in Ohio, they have horses, they have farms, and when they're out there on the farms, their animals are picking up random stuff. And if you're cleaning them, if you're cleaning off the stool, or if they get poop on them anywhere, and it turns into dust, and you breathe in that dust, you just went fecal oral, any of the oral cavities, okay? And obviously, unless you're scooping it, eating it, that's like one of the only ways you can really get it. Hopefully, you're not doing that. If you are, that's pretty disgusting. So anyway, so what are we going to do with this patient? So first off, I had to sit her down and more or less tell her, listen, I know she's still doing her chemo, which is fine right now, okay? I'm not too worried about that because we have this to kill off. Now, I'm not a huge fan of her chemo. I'm not at all, but she needs to get her doctors off of her back to be able to keep things in line. And in the meantime, what's pretty cool about it is that I have her constantly getting tested. She gets retested every single month, which is sweet. The doctor does it for me. The oncologist does it for me. He tests her M-spike. Her M-spike is perfect. It's within normal. I think it's 0.1 right now. Then her immune system is actually, all of her levels are starting to go back up. Her hemoglobin has gone up. Her hematocrit has gone up. Everything was super, super, super low. And it has been low since I believe it was 2012 was her earliest. Don't quote me on that one, but it's been years since these numbers have been going back to normal. So already, just with a little bit of protocol, even before we knew about this stool sample, I had been giving her some certain things that help with her particular type of cancer and to help to boost her immune system and get her to start functioning better. She's already doing better. And now that we know this, a lot of people get this test back and be like, oh my God, how the heck am I going to deal with this? I can't believe this. I'm so sick. Oh my gosh. I look at it the exact opposite way. Might be because I'm crazy, a little bit, in a good way. But think about that. If you have 2 bacterial infections, a yeast infection, 3 parasites in your belly, and you're already doing better, just imagine how much better you're going to feel and how much better your predictability of health into the future is going to be after we kill these things off. That's pretty neat. So she feels good. She wants to gain weight eventually, but I mean, for goodness sakes, the girl's on some chemotherapy. She's getting some metal removed out of her teeth too. She had some heavy metal fillings in there, so she's getting that taken care of, which is also getting her off of her Zermeta, because you can't do dental work when you're taking a bone density shot. So already, again, she's doing fantastic with just what I've put into play already, and then she's going to be taking us to the next level, which is awesome. So her goal is to obviously be cancer-free. I'm not here to cure cancer, but what I am here to do is fix the body, to get the body to start functioning at a much higher level, so that the body now recognizes itself as healthy, and it no longer has to present itself in a sick manner, okay? So when we're looking at this test here, I'm seeing some new people popping on here. Dr. Miller's on here. Erica Downs is on here. What's up, guys? When we go through this and go a little bit further into this testing here, we see all these other markers. I'm looking at myself as I'm working on myself. Okay, so we see these other markers on this panel here too. We look for digestion and absorption on this. We have some inflammatory markers on this. Cool thing is, even though she's got as much damage as she has down in her digestive tract, she's still pretty darn protective. She's not in an ulcerative colitis type stage. She's not in an irritable bowel syndrome or disease stage. She doesn't have mucus or blood or anything coming out in her stool. That's awesome. But then we go down to here. Look at that. Okay? Look at that stuff. That's pretty neat. So her immune system, her immunology down here in her digestive tract is poop. Okay? She's got a poop tract in her poop. So she's at 10.3, which is incredibly low. All right? That's her secretory IgA. So it's secreted by the mucosal tissue, first line of defense, central to the normal function of the GI tract as an immune barrier. Upregulated or elevated levels of SIGA has been associated with an upregulated immune response. So if it's low, her immune system sucks. If it's high, it's overstimulated. It could be autoimmune, or it could be fighting some crazy stuff. But right now, her immune system is very, very, very weak. Why do you think that is? Survey says, boom, whoa. I didn't mean to do that. Sorry. And I yelled too, so that's cool. So I got that right here. 3 parasites, yeast, and 2 bacterial infections. So what do we do? So here's the other thing here, guys. When we have this type of issue, when we have these parasite infections, etc., the yeast infections, what this is going to be doing is causing an insult to the immune system. And when your secretory IgA is low, don't think of your secretory IgA just as your immune system. Think about your secretory IgA's secretions or lubrications of your gut to be able to move things out. What do you think one of her most common complaints was? I can't go to the bathroom. Why? Well, she's got all that stuff in there that's trying to feed off of all of her stool. It's going to slow down her peristalsis in her gut. It's not going to allow her to excrete things out the way that it's supposed to. And it's going to allow her cancer to flourish. Why? Because she's going to be toxic. She's not moving the toxins out, and she's reabsorbing back into the bloodstream, which is going to lead her to leaky gut. If I also had at the time here too, she had, I believe it was 32 food allergies as well. Quite a lot of food allergies. Why? Her entire digestive tract is completely ripped apart. So one of the other things I mentioned too when she was in here in the office is that her husband was sitting there too. So obviously I asked if they were still intimate together, and you can pass some of these things back and forth in terms of yeast. If there's yeast infection, well, it's not a sexually transmitted disease, but you can pass it back and forth. Okay, so he has to be cognizant of that. She has to be cognizant of that. She has to clean herself up, and then also, if for whatever reason she had poop on her, he can't go and just mess around with that. Now, in terms of the parasites, wherever she picked up those parasites and got the fecal-oral transmission, if he's living the same lifestyle that she is, and he's working with the horses right alongside her on the same horses that maybe gave her the bacterias as well as maybe the parasites, he could potentially express these same things. But his immune system right now could be better than where hers is at. So as a side effect of her getting treatment here, I told him that it might be wise to start following some of the diet recommendations that I lay out for her, so that way he doesn't have these same symptoms kind of come about. So there's a lot of things, there's a lot of factors that go into working with patients. I'm not your typical chiropractor. I call myself crazy all the time because I love it. The reason I'm crazy is because I'm thirsty for research, I'm thirsty for information, I'm constantly learning and learning and learning. And the more cancer patients I keep working with, the number one test that always comes back with crazy things on it is going to be your stool test. Because whether it is you got your normal allopathic treatment, or heck, even let's play this side of things here too. So if we have cancer, okay, say this patient had cancer, we shipped her down to Mexico, okay, and we were just saying, I need you to just do a whole bunch of juices, I need you to just whatever, I need you to do a whole bunch of juices, and I need you to detox aggressively. What do you think that that's going to do to her body? It's going to shut her body down. Why? Because if she has all of those bacteria in her gut, and first off, she's not pooping, So you're gonna have to blast all that stuff out as you're dumping toxins into a gut that has permeability. You're gonna be causing all those toxins to get excreted into the GI system and they get reabsorbed back into the bloodstream, which is gonna make it more toxic, which is gonna make a shitstorm, pun intended, all throughout the body. The stuff's gonna go systemic. Yeast can go systemic too. Parasites can go systemic. All these things can go everywhere throughout the body. And the more it does that, the more inflammation it's going to cause. That's why a lot of people with yeast problems are going to have pain in their joints all the time. Why? Because if it slipped through and went into the bloodstream, or even just that inflammation at that level itself, that localized level is going to cause your joints to hurt. So all of these things need to be taken into consideration. And I could not and will not detox this patient until I confirm all of these things being killed off. Because if I dump more toxins into a sludgy environment and all those guys are like, yes, jackpot, feed me, feed me, feed me. All right, what's going to happen? You're going to cause all those bacteria to overgrow even further. You're going to cause your probiotics to go down even more, which is going to weaken your immune system down, which is going to make your cancer get even worse on you. There's a time and a place for everything, but you have to make sure you're not treated the same way as the last person that came in with multiple myeloma. Okay? Again, cancers are not a one-size-fit-all across the board. They truly, truly aren't. Treat the person as an individual. Treat them for their symptoms. Treat them for their causes, not their symptoms. Otherwise, you're just going to be like a normal medical doctor. You come to me, I give you this, you take this, and we see how you do. If not, come back in 4 or 6 weeks, I'll give you something else, I'll up your dose, I'll switch you to here, I'll do this, or maybe I'll refer you out to a specialist. Oh, refer you to a specialist, they can't give you any answers, but they charge you thousands of dollars. And then you come to a Wellness Way clinic. And then when you come to a Wellness Way clinic, you got no money because you spent it everywhere else. Focus on investing in yourself because there's very few places that test like we do. And that's the unfortunate thing. I mean, we just did a talk out in Erie on Friday, Erie, Pennsylvania. Why? Because there's nobody around that area that's doing anything like us. We just had a conversation with one of our patients who's being seen out in Green Bay. She had Hashimoto, and Dr. Mitch Sutton got results with her. And the husband was like, this is awesome. This is amazing stuff. And when I went up there and I spoke with these guys, he came up afterwards and was like, you don't understand. Like, Erie is very close-knit. It's a tiny town where basically there's nothing really healthy that kind of permeates in through that city. So when new things come in from the outside, it's like a breath of fresh air because these guys, they're trained. They know what's right. They know what's wrong. They're speaking out against flu shots and vaccines, and they're getting pounded from everyone around them because nobody else thinks with their brain. They don't think with their logic or research even. They just think based off emotions. So spread this information to people all around. The reason that I'm asking you to do that is not for me to go and fly or to drive and speak places. I'll do it. If you set up a talk, by all means, I will come down and do a talk for you. There's no limit for that. But what I want you to do is understand and let other people understand that there is another way. If you know someone who's been diagnosed recently and they're just on the fence and maybe they just need to talk to somebody and see that if there's something else that can be done, send them my way or send them to any of our Wellness Way offices, okay? Because we all do the same things across the board. If they have any questions, they can come to me. If I have any questions, I can come to them. It's a great referral network. The other thing, too, is if you know somebody who has been told, and this one is always kind of near and dear to the heart here, if they've been told that they're cancer-free, if they've been told that they are a survivor, if you didn't change your internal environment, if you didn't change the reason why your cancer came to begin with, sorry, you're not cancer-free. You've got about 5 years, 2% success rate for them to tell you you're cancer-free. You ring that bell, good luck. Because if you go back to eating the same stuff, you go back to eating McDonald's, you go back to slamming, milkshakes all day, every day because you think you're healed, you think your body did it, it's not going to be very long until you start feeling bad again. You go back and they come in and say, you know what? This is way worse than it was before it spread the whole way throughout your body. How could that possibly happen? That would be a video for a different time. But don't get tricked into this stuff, guys. Okay, change your environment. If you know somebody who is on the fence, send them into a Wellness Way. If you know somebody who just wants to be healthy, send them into a Wellness Way. What kind of patient am I looking for? Anyone who wants to be healthy. That's all I'm looking for. I don't do any marketing for patients. I truly don't. What I do is I help my patients try to get the best results humanly possible. And when they get those results, they tell people because they care. My patients have huge hearts for people. They're not clinically huge hearts, but they have huge hearts for people. They want to see people succeed. And when they find something that's good, they tend to refer. So that's my 2 cents, my 34-minute and 29-second video here for you guys today. Now, something else that I'll also let people know, I know a lot of the folks who are on here aren't local, okay? But if you know somebody local in the Pittsburgh area, okay, if you know somebody in that Pittsburgh area, let me know. Have them reach out, not just to come and see me, but Dr. Patrick Flynn, the one who taught me all of this stuff. Dr. Patrick Flynn is coming to do his hormone connection, ending the battle between the sexes, next Friday, November 9th at 6:30 at the Lori Ann West Community Center. It's $10 for tickets. That's it. $10 for pre-sale, $15 at the door. So get there and spread this message, because sometimes we know when we know we're right. Sometimes it can get frustrating. If we're trying to tell family members or we're trying to tell friends, sometimes we stray our friendships because we know too much. We want to help. And basically, and I had a conversation with a patient the other day about this. I go off on so many tangents. I didn't talk about that, but talked to a patient about this, and basically it was them getting very frustrated with trying to bring the message to people, and then they were like, you know what, I don't even want to hang out with you anymore. I just don't have any desire whatsoever, because every time I do, you bring up this message, I don't want to hear it, and I'm just done with you. And then the patient turns to me and is like, well, why would somebody say that when they know that I know my stuff, they know that I research, they know all this stuff, why won't they move forward with it? And I said, welcome to my world. But really, why they don't want to move forward with it is because this patient was considered to be cancer free. Okay, she had breast cancer, was considered to be cancer free. Now, she talked to me about this patient and was like, she's not exactly the healthiest person in the world, but she thinks she's cancer free. I'm like, well, listen, if you come at her, okay, and you push forward this new information, you're like, you know what? That's great that you got that diagnosis now, that you're cancer free, you got that approval, good job, pat on the back, ring the bell. But if you bring this over and she actually starts using her brain, okay, hopefully she doesn't have chemo brain, but if she starts using her brain, she's like, oh my gosh, all of that education, all of that learning, all of those dollars that she spent towards that treatment, she will now realize was a mistake. Okay, and I'm not saying that if you have a tumor in there that's impressing on an organ or something like that, that's cutting off life source, get it removed. I'm okay with that. But if you don't figure out what your underlying cause is to that tumor, to that cancer, it will just come back. An example that I always use with that is think about colon cancer. You get polyps, okay? Think about polyps like a weed in the garden. If you go through the garden and you just run the lawnmower through there, no matter how low you drop the deck and you just you cut it out, guess what's going to grow? The weed. Why? Because you never changed the soil. You never changed the environment that caused that weed to grow. Same thing in the body. If you cut the polyp out, you never change the intestinal lining here, what's going to happen? A polyp's going to come back out for you. So I can talk about this stuff all day, every day. But what I'm going to do is I'm going to start doing this more often, because realistically, I'm seeing way too much of this. And, so one of my patients says I get a little too fired up. I try not to, but realistically, I get angry, and it's kind of like a righteous anger where I get angry because this information shouldn't have to be coming from me, from a chiropractor. It should be coming from your doctors. You should be taught this stuff as soon as you grow into a person who can use their brain. As soon as you hit that age, you should be tested your entire way through life, so that way you can figure out, hey, do I have yeast infections? Do I have bacterial infections? Hey, I went out of the country. Did I get a parasite? How are my hormones? I'm going through puberty. Puberty sucks. My skin sucks. What should I do? What should I test? Test young. Test early, so that way people don't get sick like our parents, our grandparents, our sons, our daughters, you name it. Early detection is only done by proper testing, not through mammograms. So I'm just going to leave it with that today. I keep getting phone calls, so somebody's going to be upset with me for not answering the phone. Hopefully it's not any of you guys. But again, thank you for commenting. Thank you for popping on for us, guys. But let me know if there's anything that you specifically would like me to talk about. Cancerous therapies. I will be doing more research into autonomic nervous system and nutrition. Once I am done reading Dr. Gonzalez's book, I'm going to put together some stuff, and I will put together a PowerPoint presentation. It's going to be way more official than what I'm just doing here, just randomly pulling stuff up. So that way we can sit down and have a conversation on how diet and nutrition can influence your autonomic nervous system, so your sympathetic and parasympathetic nervous system, and how that can also help with fighting against cancer. So long for today. I've got a phone call, actually, which is probably what that was. So I got to go. I got to go over another stool test. I'll talk to you guys later. Have an awesome day.